Hey guys, how's it going? This is FixerMed. Welcome back to my high yield genetics review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 4 of my multi-part video series covering the entire discipline of genetics in a comprehensive and high yield manner. So without further ado, let's go ahead and get started on today's content. So I'd like to open up talking about biochemical genetics, inborn errors in metabolism. Biochemical genetics involve the study of genetic disorders that affect metabolic pathways. Inborn errors in metabolism are genetic disorders characterized by enzymatic defects in metabolic pathways leading to the accumulation of toxic substances. Today's lecture is going to be very reminiscent of the material we covered in biochem, so just keep that in mind as we go through this video. I like to start off talking about phenylketonuria for first inborn error metabolism. PKU is an autosomal recessive disorder affecting phenylalanine metabolism. The main biochemical basis for PKU is a deficiency of the enzyme phenylalanine hydroxylase, leading to elevated phenylalanine levels. Primary clinical features of PKU include intellectual disability, microcephaly, and seizures. Diagnostic tests for PKU include elevated phenylalanine levels on newborn screening, which is confirmed by genetic testing. PKU is managed by a phenylalanine restricted diet and early intervention. Moving on. Next, we have galactosemia. Galactosemia is an autosomal recessive disorder affecting galactose metabolism. The primary biochemical basis for galactosemia is a deficiency of enzymes involved in galactose breakdown, leading to elevated galactose levels. Clinical features of galactosemia include jaundice, hepatomegaly, and intellectual disability. Diagnostic tests for galactosemia include elevated galactose levels in blood and urine, confirmed by genetic testing. Management of galactosemia is done through a galactose-restricted diet and avoidance of lactose-containing foods. Moving on, we have maple syrup urine disease. Maple syrup urine disease is an autosomal recessive disorder affecting branched-chain amino acid metabolism. The primary biochemical basis for maple syrup urine disease is a deficiency of enzymes in the breakdown of leucine, isoleucine, and valine. Clinical features of maple syrup urine disease include sweet-smelling urine, neurological symptoms, ketoacidosis. Diagnostic tests for maple syrup urine disease also include elevated branched amino chain acids in blood and urine. Sorry about that. It's elevated branched chain amino acids in blood and urine, which are confirmed by genetic testing. Management of maple syrup urine disease is primarily done by dietary restriction of branched chain amino acids. Moving on. Some key clinical considerations to keep in mind. Early detection is crucial for effective management of biochemical genetics disorders. Newborn screening programs play a vital role in identifying affected individuals shortly after birth. Timely intervention can prevent or minimize the development of severe symptoms and complications. It is important to take a multidisciplinary approach to inborn errors of metabolism. Successful management requires a collaborative multidisciplinary approach. Geneticists, pediatricians, dietitians, and other specialists work together to provide comprehensive care. Regular follow-ups and communication among team members are essential for monitoring and adjusting treatment plans. Genetic counseling. Genetic counseling is an integral part of patient care for individuals with biochemical genetic disorders. Genetic counselors educate families about the nature of this disorder, inheritance patterns, and available treatment options. Support is offered to help families make informed decisions about family planning and managing this condition. Therapeutic options. Dietary management is a cornerstone in the treatment of many biochemical genetics disorders. Strict adherence to specialized diets help regulate metabolite levels and mitigate symptoms. In some cases, enzyme replacement therapy or other emerging treatments may be considered for specific disorders. Patient and family support. Patients and their families often face emotional, financial, and social challenges associated with these disorders. Support groups and community resources play a crucial role in providing emotional support and sharing experiences. Raising awareness about available support networks is essential for enhancing the overall well-being of affected individuals and their families. Some key takeaways include early detection, a multidisciplinary approach, genetic counseling, adherence to therapeutic options contribute to improved outcomes, ongoing communication and collaboration among healthcare professionals and support networks are essential components of patient care. Patient and family education are crucial for empowering individuals to manage these disorders effectively. Moving on, we're going to start doing some questions now. We have a 3-day-old newborn presents with irritability, vomiting, and seizures. Laboratory tests reveal elevated levels of phenylalanine. Newborn screening confirms the diagnosis of a metabolic disorder. Further genetic analysis identifies mutations in the PAH gene. Which of the following is the most likely diagnosis? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video and gather your thoughts. Otherwise, moving on now. PKU is an autosomal recessive disorder caused by mutations in the PAH gene. Clinical features include irritability, vomiting, seizures, and intellectual disability due to the accumulation of phenylalanine. Therefore, the correct answer is C, Phenylketonuria, PKU. Moving on to see why the other answer choices are incorrect. Galactosemia involves the inability to metabolize galactose and presents with hepatomegaly and jaundice, not elevated phenylalanine levels. Maple syrup urine disease is characterized by the accumulation of branched-chain amino acids leading to a distinctive sweet-smelling urine. It does not result in elevated phenylalanine levels. Homocystinuria involves a defect in homocysteine metabolism leading to skeletal abnormalities and cardiovascular issues. It does not result in elevated phenylalanine levels. Tyrosinemia involves the accumulation of tyrosine, which can lead to liver and kidney damage. It does not cause elevated phenylalanine levels. Moving on, we have a 6-month-old infant that presents with developmental delay, vomiting, and a distinctive sweaty feet odor. Physical examination reveals hypertonia and hyperreflexia. Laboratory tests show elevated levels of leucine, isoleucine, and valine in the blood. Genetic analysis reveals mutations in the BCKDHA gene. Which of the following is the most likely diagnosis? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Maple syrup urine disease is an autosomal recessive disorder caused by mutations in the genes involved in branched-chain amino acid metabolism, including BCKDHA. Clinical features include developmental delay, vomiting, hypertonia, hyperreflexia, and a distinctive sweaty feet odor due to the accumulation of leucine, isoleucine, and valine. Therefore, the correct answer is C, maple syrup urine disease. Let's go ahead and see why the other answer choices are incorrect. Phenylketonuria, PKU. PKU is characterized by elevated phenylalanine levels leading to intellectual disability. It does not involve the accumulation of leucine, isoleucine, and valine, or the sweaty feet odor. Homocystinuria involves the defect in homocysteine metabolism leading to skeletal abnormalities and cardiovascular issues. It does not result in elevated leucine, isoleucine, and valine levels. Gaucher disease. Gaucher disease is a lysosomal storage disorder, not a disorder of amino acid metabolism. It presents with hepatosplenomegaly, anemia, and bone abnormalities, but not with elevated branch chain amino acids. Glycogen storage disease, GSD. GSD involves defects in glycogen metabolism leading to hypoglycemia and hepatomegaly. It does not result in elevated branch chain amino acid levels or the specific sweaty feet odor seen in maple syrup urine disease. Now, this will do it all for today's part of the genetics review series. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. And also would appreciate if you could leave a like and potentially subscribe to the channel for more content like this. If not, it's all good. This is FixerMed signing off. Be sure to have a great day, everyone, and happy studying.